The human body is a symmetric structure. In the early stages of life, this symmetry is substantially maintained, given that both sides of the body are used equally in all physical activities. But when children enter school, for the first time they begin to use almost exclusively one of the two sides of the body, the left one if they are left-handed, the right one if they are right-handed, to draw, write, and perform most daily activities, while being seated for many consecutive hours. This tendency creates serious imbalances in the musculoskeletal apparatus and between the motor cortices of the two cerebral hemispheres. These alterations, along with growth and aging, promote the premature degeneration of the psychomotor system, predisposing the individual to a wide range of vertebral column disorders such as cervicalgia, low back pain, sciatica, swelling in the joints, etc. Through the observation and the study of the phenomenon of movement lateralization, which brings a side of the human body to prevail on the other, Valentin Loney has developed new rehabilitation techniques aimed at restoring perfect bilateral symmetry and neuromotor equilibrium. The Loney method. Gymnastics of postural reprogramming connected to the body median sagittal line through deambulation axis, suitable to people of all ages. The Loney method is applied in two main phases, a static phase and a dynamic phase. The static phase is used to relieve muscle tension in the body, thus realigning the skeletal structure of the individual. Once the body balance is restored through the static phase, the dynamic phase will improve symmetrical muscle growth and reinforcement of the body structures responsible for maintenance of good posture. These rehabilitation techniques are applied through the use of 4 gym devices, specifically designed by Mr. Loney himself to guarantee recovery of the hypertrophic side of the body. Thanks to their peculiar perforated board structure, which provides holes for wooden rods and laces, the Loney devices enable patients to easily perform physical therapy exercises in the correct position, hence restoring muscle tone and elasticity in the neglected side of the body, which is brought back to its original symmetry. Each Loney method device is designed for specific body parts, and they are the following: Rebirth, Erectus, Median, Deep Power. Rebirth. A perforated board whose holes are designed for specific wooden rods of different heights, used to make the patient work in a perfectly symmetric way on static stretching and dynamic strengthening for limbs and torso. The Rebirth provides treatment for those who suffer from any kind of musculoskeletal pain and postural disorder, such as scoliosis, hyperlordosis, hyperkyphosis. It allows to restore physiological lateral rotation of the trunk on both sides and to reinforce upper limb muscles through controlled and symmetrically executed push-ups. This great platform is also effective in back strengthening when used to perform extension movements of the trunk, and it is a powerful tool for quadriceps femoris symmetrical tonification. Erectus. A device consisting of a perforated board which lies between 2 symmetric vertical walls, provided with holes made to accommodate different wooden rods in horizontal position. It is used to restore postural equilibrium through dynamic stretching exercises of the vertebral column and strengthening exercises of the following dorsal muscles: the iliocostalis, located laterally, the spinalis, located medially, and the longissimus, located between them. Each set of exercises on the Erectus consists of 2 phases: a descending phase, during which the patient must stretch out to grab 2 rods which are positioned in front of him at an appropriate distance. In this phase, the muscles of the back and the vertebral column itself are subjected to a deep dynamic stretch. In the second phase, the ascending one, the lower back muscles work together to bring the body back to an upright position. These muscles tone up significantly while working in a perfect symmetric way, thanks to the rods, which prevent one from moving off their axis. Furthermore, one of the exercise sequences provides and promotes rotation movements of the trunk to help the patient recuperate the ability to rotate the torso with the same range of motion on both sides. Median. Consisting of a wooden wall provided with round holes, median is a device specially designed to treat neck pain and cervical disc protrusions. Through specific exercises for the shoulder girdle, it is possible to symmetrically strengthen this area, improve its mobility, and gradually restore proper biomechanics of vertebrae, scapulae, clavicles, sternum, and ribs. Thanks to wrist and shoulder rotations, flexion extension and adduction-abduction movements of the upper limb, it is possible to activate and strengthen the rotator cuff and the muscles in the neck. When muscle symmetry is restored in neck and shoulders, a cervical vertebral realignment is obtained. Neck muscles asymmetry is, in fact, the major cause of cervical vertebrae dislocation. Deep power. Consisting of a perforated bench shaped to duplicate the physiological curvatures of the spine and of two lateral supports made to accommodate several rods at different heights in a horizontal position, Deep Power is the perfect device for symmetric abs and core workout and muscle lengthening of the trunk. It is made to restore proper anatomy, physiology and biomechanics of the rachis and to train someone in a perfect symmetric way thanks to rods which are used to fix the body in a correct position during the workout. It is also very efficient when it comes to strengthening trunk stabilizer muscles. Each exercise is preferably done without laying the head on the bench during the descendant phase in order to reinforce neck muscles, especially the sternocleidomastoid. Finally, the repetitive act of grabbing the horizontal rod with both hands is a powerful way to deeply stretch the muscles of the shoulders and torso, to strengthen all the flexor digitorum muscles and to expand the rib cage with a significant increase in all lung capacities. The hand grip is fundamental in each exercise of the LONEY method. In fact, every single upper limb movement, which sees the patient grab one or two strategically positioned rods, is made to rebalance and, at the same time, harmonically increase hand strength. And since several scientific studies have proven that a weak hand grip is associated to a higher chance to experience major cardiac events, the LONEY method, with its enormous benefits on the cardiovascular system, is thus a valid aid in serious heart disease prevention. The LONEY method improves one's overall athletic performance, strengthens the cardiovascular system, and increases all lung capacities, bone density, and muscle tone. With a series of exercises designed to preserve articular cartilages, the method also improves cardiovascular endurance and general flexibility. Valentin Loney has carried out psychomotor rehabilitation programs for people of all ages for more than 10 years, with the ultimate goal of complete posture reprogramming through symmetric reactivation of all the musculoskeletal districts of the body, which finally regains equilibrium, energy, and health.